Attention all pharmacy industry professionals. This isn't your grandfather's podcast. This is...
What the hell are you talking about? Our grandfathers never even listened to podcasts. The internet wasn't even around.
Shut your pie hole. My grandfather loves podcasts, and so does my maca.
Your what?
This is the RxRated podcast, part of the Pharmacy Podcast Network.
Did you say maca?
Put the fidget spinners away. Punch in the coordinates for the jump to light speed. And do or do not. There is no try.
What kind of asshat introduction is this?
The podcast dedicated to all the pharmacy professionals in this crazy sector of healthcare.
What was that?
The RxRated podcast.
Dude, seriously? You already said that 3 other times. This is bullshit.
Welcome to the RxRated podcast. This is your host, Dr. Jeffrey Wenger, and as with me as always, yeah, that makes sense. Dr. Robinson, how are you, sir?
I'm good. How are you guys?
We have with us today a special guest, the CrazyRxMan, who I follow on Twitter. Say hello, sir, and tell us a little bit about yourself.
Oh, it's very good to be here. Thank you for having me. Yes, I am the CrazyRxMan, and the name is not actually that far from the truth.
Was it retail pharmacy that made you crazy?
It is. I actually, this is a career change for me. I'm like in my 50s, but I've only been a pharmacist for about 20 years. I had actually, before this, I had an art gallery in Arizona. And after 9/11 happened, it was not so good for tourism. So I decided to switch to the career that I had wanted to be in my whole life. All the way going back to high school, I was interested in pharmacy. But instead of pursuing that, I decided to take over the family business. And after 9/11 happened, there was no more business. So I changed careers and first started out as a technician and went to Midwestern, where I figured out that C's earn you degrees, and also learned that anyway at Midwestern, they weren't so much interested in teaching you pharmacy as opposed to just getting people to pay the tuition. So I kind of felt like I taught myself pharmacy as I went through pharmacy school. And I started working for a grocery store pharmacy, which you've probably seen on the blog that I call Goof Mart Pharmacy. And I call it that because there's a lot of goofy things that go on, and the goofy things that have happened, basically dealing with crazy customers, insane doctors, and insane management, that's all made me crazy. And that's when I decided to start the blog and get on Twitter.
Don't forget nurses that can't do basic math.
Yeah, well,
that's a big gripe of mine.
Don't argue with them. I'm a nurse. I know what I'm doing. Don't argue with me. Yeah, I know exactly what you're talking about there.
So you've got 13,700 followers on Twitter. How did you get so many? What was the key?
Well, I was tweeting a lot for a long time. And I think what it was I was getting... I don't know, I just kind of hit a chord, and like I kind of kept hidden what company I worked for all these years, but I would get tweets and direct messages from people, and they would say, "Oh, I know what it's like working for CVS." All these people would say that they knew what company I worked for, but they had it wrong. The reason why is because retail pharmacy is just insane for everybody that works in it.
Touche. And you do a blog too, right?
Yes, I have a blog. I haven't been blogging as much as I used to. I kind of lost my wind on that. What's happened is, and it's kind of odd, is that 13,700 followers on Twitter, but that number hasn't changed in about 2 years. Although I keep, people keep following me, apparently I'm losing them as much as I'm gaining them. Or, as I suspect, there might be some funny business going on with Twitter.
Dr. Robinson, how many followers do you have on Twitter? Do you know offhand?
Twitter, I don't know. because there's just so many different platforms. It's so hard when you work 40 hours a week to keep up with all the different platforms. So like I keep up with Facebook and YouTube a lot. I have the Twitter, but I kind of stopped using it after, I started to gain more popularity on Facebook and YouTube.
Speaking of YouTube, you've had some really good videos posted recently. I'll just list a few and then tell us a little bit about each one. Like pharmacy staffs at their breaking point, pharmacists and technicians being pushed too far in retail, why the pharmacy should be like the DMV, why I hate pharmacy metrics, and my favorite one, what is the best way to bring about change in retail pharmacy? Can you speak to some of those?
Yeah. So one, I just wanted to bring more ideas to the table of the best ways to bring about change. Because a lot of times we like to say, hey, we need to get to the big news agencies and reporters about the understaffing. But when I Google understaffing in pharmacy, I find stuff all the way to like 2014. And, there's already been articles in major newspapers like, Chicago Tribune, New York Times, and other ones. So I'm like, is that really the best way? Because it's been done. Part of me feels like, yeah, the public may become aware, but they really don't care if they're still getting their prescriptions and it doesn't affect them at all. So just trying to get different ideas from other people. What do they feel is the best way to bring about change? And then a lot of people have been messaging me just with COVID. Like they're so scared to speak up, but they just really can't keep up with the demands from the COVID vaccines and getting everything else done. So I tried to find creative ways to give people a voice. So I'll take something that they wrote and have somebody else read over it and then kind of post it. Or I'll take people's posts from my page and, remove their name and just, collect all the information, all the comments to show like, hey, it's not just one person saying the pharmacist was overworked and passed out or had to go to the emergency room or died. It's 12, 15 people. And then when you post that, even more people post. So I'm just trying to prove that, this isn't just a one-off where a pharmacist died or had to go to the emergency room. There's a lot of pharmacists and technicians who are just so overworked that, they physically exhaust themselves until it starts to affect their health.
Well, I'm sure you guys saw this article. I sent it to you it was NBCnews.com titled Overworked, Understaffed. Pharmacists say industry in crisis puts patient safety at risk. And they interviewed a pharmacy manager who said, quote unquote, it's almost impossible for any human to keep that momentum day in and day out. And my first thought was almost impossible. No, it's actually impossible.
Absolutely.
And the person said, 13 years ago, the profession was different. I agree. I got into it about 20 years ago, and it was a totally different profession back then. So now we have like 155,000 pharmacists that work in chain drugstores, and they're all pushed to do more with less. And this is a growing trend. It's been going on for quite a while. NBC News spoke to 31 retail pharmacists and technicians in 15 different states, and they complained about the 12-hour shifts with no time to go to the bathroom. You can't eat. They cry in their cars after work. One CVS tech said, quote, the expectations they're having and the resources they're giving us just aren't adding up. That was in New York. And they said, we're going to have a fatal error eventually somewhere because we're doing too many things at once. And most pharmacists in the article spoke anonymously because they're afraid for their job. Isn't that scary that we can't even honestly speak out without using, like we do, pseudonyms or whatever?
Yeah, it's a little crazy out there when you think about it. If you look back 20 years, think about how things have changed. We didn't have 20 years ago, there wasn't medication therapy management. There wasn't vaccinations. There wasn't an overload of prescriptions. It's become a situation now where we're expected to do more work, but no one has had an increase in tech hours or staffing.
And this article referenced a New York Times article from January 31st, 2020, titled How Chaos at Chain Pharmacies is Putting Patients at Risk. And they talked about to an Alabama pharmacist about metrics. And he said, basically, your day is timed out by the minute. It's like the worst case of micromanaging you can imagine. Dr. Robinson, you did a YouTube video about how you hate metrics. Tell us a little bit about your disdain for metrics.
Yeah, I definitely hate metrics, especially when they know that you don't have the staff to actually meet these metrics. So to me, it's like, if you're not going to give enough staff to help the pharmacies meet these metrics, why do you have them? And I think that they just keep them so they have them as a punitive type of tool where they say, hey, we want to get rid of you because we want a pharmacist that's, let's say is not as vocal, or maybe a pharmacist that doesn't make as much, or we just want somebody else, to take your place. So, we'll keep these metrics and then we'll hold it against you and, use it as a way to write you up or give you a terrible evaluation. It's just a punitive tool that they keep, but it really adds no value to the pharmacy because they don't give enough help.
There was a 2019 National Pharmacist Workforce Study, and over 2/3 of the pharmacists said that workloads have increased, and 91% rated their workloads as high or excessively high. All the while, wages have remained stagnant or fell, and job security, or the ability to find new work, has decreased. I think we can all agree, almost no matter where you are, the market is totally saturated. It's almost impossible to find a job these days. There's twice as many pharmacy school graduates as there were 18 years ago, yet the number of pharmacy jobs has not grown at the same pace. And then the Bureau of Labor Statistics predicts that the industry will shrink by 3% in the next decade. That's some scary shit, am I right?
Absolutely. And don't forget that in many places, they've reduced the number of hours that they're giving staff pharmacists to work. In Goofmart, at the stores, they reduced the staff pharmacists to 32 hours a week, yet the number of prescriptions hasn't gone down. It's just, it usually ends up being more work for the managing pharmacist or whoever's there.
And now we got to give COVID shots on top of everything else.
I want to read you a comment from my metric video that a viewer posted, if you don't mind.
Oh, please.
All their metrics are not there for the improvement of patient outcomes. They are there to allow low-level and upper-level middle management to micromanage the pharmacy, even though they have no clue how it gets done. Because pharmacists can't bill for our true services, OTC and med consultations, diabetes educations and screening, lipid screenings, MTM consultation, vaccinations, and et cetera. The companies will continue to use metrics as a way to gauge our productivity and try to improve prescription volume output. Doctors, nurse practitioners, PAs, et cetera, they can all bill for their true services. The only real service we can bill for is the end product of a written prescription. Even vaccinations are not billed from the medical end, but the pharmacy end as a prescription. I don't see a future in pharmacy. Other professionals' pay rates increase over the years to accommodate for inflation and increased workloads. Pharmacists as of today are getting paid what I got paid almost 20 years ago when I was hired. Yet the cost of a pharmacy degree is more than the cost of a home in most parts of the country. What the fuck?
Exactly.
So what's the solution? Should we unionize? Is that the answer? Because I have a fear of unions, because a lot of times unions will preserve the shitty people when they should be fired, but you can't fire them because the union's protecting them. Is that the way to go, or is there a better way?
Well, I don't presume to have all the answers, but something has to change. I hate the idea of unions like you do.
Yeah.
Maybe some sort of, I mean, it's obvious we cannot, we're not going to get any help from the APHA. We're not going to get any help from the organizations that are out there, but we need some sort of solidarity.
That's why I made that video, because I was hoping that people could brainstorm and figure out a better way, whether we all just kind of focus our efforts and everybody just email and constantly message their local congressman or congresswoman, or Because unfortunately, if people just making more mistakes, or things might not change until like people actually start getting hurt and dying. I can only imagine with COVID how many mistakes pharmacists are making, but I guarantee you they're not even recording them. They're probably just fixing them and moving along. So you can't even really show how many mistakes, pharmacists are making with all the extra workload with COVID. So the only thing that I could really think of to truly bring attention is a strike. But last time I was reading about the strike, it didn't work and they just ended up caving in. So,
and I know it's not politically correct to say this, but I think part of the onus, a small part of the onus, should be on the public. Don't stare at us when you're waiting for your prescription. That puts pressure on us. We can't concentrate. Don't be rude and swear and cuss and be demanding, and think ahead. If you're running out of pills, call in that refill before you're totally out. There's all kinds of things that the public can do to help us out too. Am I right?
Yes, absolutely.
Yeah, go ahead.
There should be more, just basic politeness with customers. They think that we're just there to get it done now, and it just doesn't work that way. And it's hard to explain that to some people.
That's why when I was jokingly made that video, I said we should be more like the DMV, because when I go to the DMV, everybody knows you gotta wait and people don't complain.
Yeah.
And it's like you take a number and you just sit there until your fucking number's called. And when I was at the DMV, people were politely waiting, and like the people who work back there didn't look stressed, and people just wait because they know that you have to wait at the DMV. Whereas retail with the commercials, they make it seem like, oh, you just pop up, there's only one person in line and the pharmacist will take care of you right away. So they get this false sense of reality based off of the commercials. And so I think that's kind of just part of the problem, how it's marketed on TV.
Do you guys think that the drive-through is partially responsible for that? Because they think of us as sort of a McDonald's, like we're McPills, and it should be fast and easy. And it's just, they don't realize that you can't just quote unquote slap a label on it. There's a lot of steps involved, and they just don't realize that because the drive-through makes them think it should be quick and easy, like a fast food restaurant.
It's definitely not a Happy Meal. So you're exactly right. I really believe that has had an effect on it. It gives people the idea that it's fast food.
Yeah, I think, like, here's an example. I had one lady who came through the drive-through, and she had a prescription that had no insurance on it. And she had three kids. Of course, they all had like different dads, different insurance cards. So I told her she had to come inside so I could try to update the insurance. And she's like, I'm not leaving the drive-through. So instead of, spending all this time going back and forth, I just updated all three. So then the person who came behind them said, well, what took so long? This is the drive-through. You're supposed to just pick up, drop off. And I tried to explain to them that, that's how it should be, but the other person wouldn't move. So it's like some people get upset because they think the drive-through is just drop off and pick up and should be quick, which it shouldn't. Other people just think that they could do whatever they want in drive-through and not come inside. And it just, everybody's sense of how the pharmacy drive-through is a little bit different.
Yeah. So those of us who've worked for some of the bigger corporations, I won't say any names, the phone is constantly ringing off the hook. You have a call on line 1. You have a call on line 2. You have 2 calls. Drive-through, lane 1. Drive-through, lane 2. It's nonstop all day. How are you supposed to concentrate? And then you got the person at the consultation window saying, excuse me. And then your technicians don't want to go to the drive-through because let's face it, it's a pain in the ass. So they pretend not to see the car at the drive-through, or they pretend they don't hear the phone ringing. So another part of the onus is on staffing. Is there a way, in other words, to get better staffing? Should we pay techs more per hour to get better quality help?
I've been a big proponent that technicians have been underpaid for years. It just especially, anywhere from $10 to $15 an hour is just not conducive to attracting the right kind of people that we need in the pharmacy. Also, we need to have more technicians and pay them more so we can attract smarter people.
Yeah, because most of the good technicians I've had have been college students, which means they're there for a little while because they're pursuing something, and then they're going to be gone in 3 years or whatever it is. So they're not there for the long term, in other words. If you want someone good who's going to invest in this for the long term, you got to pay them something that's going to incentivize them to want to stay. You're not going to get a quality person, in other words, to stay for 10 years if you're just going to pay them $9 an hour or whatever it is. You know what I mean? So yeah, my best techs have always been college students, but they're in and out in a relatively short period of time. And that's a bummer.
What's a good pay? Because when I was making $60 an hour, I didn't want to be there. So what do you think that should get? And plus it's hard too, because I've been a pharmacy manager. You just no time to train them. So half the time, by the time they quit, I couldn't even really tell if they were good or not, because that you just stick them at drive-through or out window and you try to train them, and then they just get so overwhelmed because they're not getting properly trained and frustrated. And then you're trying to learn, and customers yelling at you because they expect you to know everything. And if you tell them you're new, they don't give a fuck that you're brand new. They just want their prescription in. So it's just really hard.
CrazyRxMan, what kind of pharmacy technician turnover have you had over the years? Are they in and out pretty fast, or do they hang in there?
Well, you've got some that at my company that have they've been there a while, and some of them have been, I don't know, they've had pay increases such that they're paid more, and they've earned the right from the company to earn more money. And some of them have transitioned from the produce section, and they've been around for 20 years in the company, and so they're making $25 an hour.
Oh.
They end up in the pharmacy, and those are the ones that stay. The ones that I've seen that come and go very quickly they're not out of school, they have no education, and they're just looking for something to do for right now until they find out how much work is actually involved.
Yeah.
And then disappear.
Jesus, $25 an hour. I'd be willing to be a tech for that much. Like, screw the responsibilities of being a pharmacist. I'll just be a tech for $25 an hour. I could hang with that. That's almost half of what a pharmacist makes, right?
Well, I think a lot of your hospital technicians, pharmacy technicians, make about $20 an hour.
That ain't too shabby either.
They also have differential for working at nights and things like that. And they also have annual reviews for pay increases.
Hey, I got a question for you. At Goofmart Pharmacy, are the district supervisors and the higher ups, are they pharmacists or not? Because I'm finding that a lot of companies have non-pharmacists running the show.
It's true at my company. We have pharmacists for the upper management. But I like at Sam's Club and Walmart, they don't. So it's, I guess it just, like you said, depends on the company. And I haven't had any experience with that myself, but I do have friends that worked for Sam's Club that said it was really hard to have people direct you or manage you who don't really know anything about how pharmacy.
Exactly. I find that crazy because they don't know what it's like to be in the trenches, and they're preaching metrics and all this shit. And it's like, I'm running around like a rooster with my head cut off for 12 hours, and you're saying that I'm stuck at the computer and I'm not multitasking. All I do all goddamn day long is multitask. You can't work in a pharmacy and succeed or survive without multitasking. Like, they're oblivious, right? It's Dr. Robinson. Like, do you get that?
Yeah, I've probably had 2 district managers that were pharmacists and 2 that weren't pharmacists. I like the ones that were pharmacists because they would just text me like, hey, fix this metric. Like, let's say phone wait times were off. And I'd be like, okay, guys, we got to do a little bit better with the phones. Whereas the ones who were like non-pharmacists would actually like come in there and try to have a 20-minute conversation as to why the phone wait time was 2 minutes and 30 seconds and not 2 minutes, and what were the barriers. And this is like right after we had a buyout. I'm like, if you looked at the numbers and saw that we were doing an extra 100 prescriptions per day, you could probably correlate without coming in here and wasting 30 minutes of my time as to why the wait time went from 2 minutes to 2 minutes and 30 seconds. But like I said, the ones that were a pharmacist would literally just text me like, hey, watch this metric. And I would do what I had to do to get it back. Whereas like the ones that weren't would actually try to come in there and walk around and have a 30-minute pointless conversation about phone wait times.
Now, when those knuckleheads would come in there, would you keep working or would you stop working to talk to them?
Oh, I would always. I'm picking up every phone call. I'm picking up every phone call. I'm at the out window. I'm doing that detailed that counseling where I actually go to the OTC aisle. I'm like, oh, I can show you where that's at. Let's go.
I used to try to stop working and entertain them out of respect because they're my superior. But eventually I just said, fuck it. I want them to see how goddamn busy I am since they think I just verify all day and that's all I do. So I quit doing that and I would just run around while they were trying to talk to me, give them a sense of reality.
I got to tell you a funny story. I had a pharmacy manager that was, he was working a 12-hour day and the regional manager had come by to reset one of the displays, because it has to work. They all have to look exactly alike from store to store. And so Mickey, the manager, was running around crazy like, with the chicken with no head there. And finally, he turned to the manager. He says, look, if you're not going to help me, why don't you just get the hell out of the way?
Good for him.
I still laugh about that because Mickey was an older pharmacist and could pretty much say anything he wanted because he didn't care if he got fired. He was ready to retire the whole time that I knew him. And so he would get away with things like you wouldn't believe. So it was good to hear that little story.
I like him already.
I had a pharmacist who had a district manager who was not a pharmacist come in, and because I guess they were getting complaints about drive-through taking too long. So she eventually got so upset. She goes, if you think it's so easy, you do the drive-through. And when he tries to talk to the first car, he starts talking over the PA system. She's like, you can't even work the drive-through. Unfortunately, shortly after, she was no longer but it's kind of like pointing that out. And, the person couldn't even work the drive-through. They're talking over the intercom.
So maybe that's one of the solutions is for corporations to hire pharmacists to be supervisors and district managers and not non-pharm. I don't even know why that trend ever started. When I was starting out in pharmacy, it was all pharmacists. But lately, it seems like a lot of non-pharmacists are running the show. So maybe that trend needs to end.
They probably won't have district managers in the future because like a lot of these pharmacies, they're like partnering with MD groups. So it's like pharmacies and MD groups. And then they short out some of the front end part. So if you're getting rid of a lot of the front end, it's just pharmacy and a doctor's group, then what do you need a DM for?
Exactly. Well, gentlemen, this has been a great discussion. I know, Dr. Robinson, you have a heart out, so we're going to let you go. I might chat some more with CrazyRxMan. And
all right.
All right. We will talk to you soon. Have a good day.
Bye-bye.
Bye-bye. Okay. So Dr. Robinson has signed off. He had a heart out. He had to go. So we can continue to chat if you want about anything.
Sure.
I'll give you a little background on me. So I was going to the University of Central Florida to pursue an engineering degree because I was good in math in high school. And I thought that was the logical thing to do. I had no idea what an engineer did. It got to the point where I just couldn't handle the math anymore. It was beyond me. And I was stocking groceries at a supermarket at the time. And I was selected among a few guys to open up a new store in Orlando. It was the biggest one in Orlando at the time. And it had a pharmacy. And I thought, well, that looks intellectually stimulating. I'll try to get my foot in that door. And to be honest, it took a while. They did not want me in there. I guess, some pharmacists are skeptical and they think, well, who knows why he wants to get in there? Maybe he's a druggie or something. Eventually, I won their trust. I got in there, became a tech, and decided, yeah, this is the life I want. I want this guy's job. Took 3 years, finally got accepted. I applied for 2 years, was denied. Finally applied nationwide, got accepted to a school, and eventually became a pharmacist in 2004. and did it for about 20 years. And like I said, the profession was great at the start. It has progressively gotten worse, as we discussed. And so now I'm completely out of pharmacy. And I am a United States Postal Service worker making $19 an hour, loving life. I go into work at 7 in the morning. I got my headphones on. I'm casing the mail for a few hours, just listening to podcasts or music or whatever. And then I get in my truck and I deliver the mail. That takes about 2 or 3 hours. Again, I got my little speaker. I'm just listening to podcasts, music. In other words, I'm by myself all day long. No phones ringing, no supervisors breathing down my neck, no coworkers annoying me. And then I get done based on how fast I go. So if I haul ass and I get done at 1 o'clock in the afternoon, I'm off the rest of the day. It's beautiful. I love it. I'm out there in the beautiful weather. I'm seeing people walking their dogs. I'm handing little kids the mail. It's great. Even though I'm making 1/3 of what I was making before, I'm experiencing 1/10 of the stress. So that's a win-win for me.
That makes it worth it.
Yeah. That's me in a nutshell.
Well, I'm curious, do they, let's say you got a whole bunch of mail, do they just pay you for an 8-hour day, no matter how long it takes you to deliver it?
I'm in my 90-day grace period, so I get paid for however long I work. After my 90 days, I think it is cut off. Like, okay, so if you get done early, you still get paid until such and such time. But if it takes you beyond such and such time, you're not getting paid. So there's a cutoff. I think right now I'm so efficient at it that I will get off work and still get paid for another 3 hours. Once my 90 days is up, I'm still within that range. But yeah, in other words, my advice to everybody is if you're miserable at your job, there's other things you can do. You don't, even though you have your PharmD, I was actually the last class to have an option. Like I could have just gone with the regular master's, or I could have gone for the doctorate. I decided to go for the doctorate. My class was the last one to have that option. But even though you invested all this time and money, don't think that I want to enjoy my life now. So I'm looking to retire pretty soon. My house is paid off. My car's paid off. I have no debt. I'm just enjoying life now. And thank God. I couldn't imagine a better place to be. And if the USPS thing works out, I'll keep doing that. If not, I'll quit and retire. Who gives a shit?
Well, you get those government benefits too.
Yeah.
When you not get that until 90 days.
Yeah, if I hang in there. We'll see. I enjoy it, so we'll see. Maybe I'll just do this for the next, who knows, few years. And then once my wife says it's okay, I'll retire. It's all up to her.
Hello, it's your drug dealer. I thought I'd call in case you needed anything at all. You know, you can always call me just to talk, but I mostly want to sell you drugs. Drug dealer.